Welcome. This presentation explores Crohn's disease, a chronic inflammatory condition of the gastrointestinal tract. My name is Emanuela Rojas, and this project was prepared for Dr. Amanda Brandt's Human Anatomy and Physiology 1 course at Lake Sumner State College. I will highlight its causes, symptoms, affected systems, and treatments. Most importantly, I will share an interview with my daughter, who agreed to offer her personal perspective on having been recently diagnosed with Crohn's. Crohn's disease affects approximately 750,000 people in the United States and 6 to 8 million people worldwide. It is a form of inflammatory bowel disease, or IBD, and is more commonly diagnosed in adolescents and young adults. Though it can occur at any age, the peak onset is between 15 and 35 years. When did you first start feeling sick?
It was around January, the New Year, so a couple months ago. At first, it was like small little things, and then it started getting worse. Like cramps, similar to cramps, and feeling tired, weight loss.
And quite a bit of weight loss, like 12, 14
Yeah, 12
pounds.
pounds or so.
And you said stomach pains, abdominal pains?
Yes, like right here in the lower hemisphere.
Okay. And what about your bowel movements?
I would go more frequently and also at night.
How many times at night?
At first it was like 1 or 2 times, and then like after I got sick with something else, it started getting worse, as well as with the cramps and also being tired.
For like a week or so, it was 4 times a night, right?
Yeah.
And you had some blood in your stool as well?
Yes, I never noticed because like I don't look for that. When I went to the hospital, yes.
The most common symptoms of Crohn's include persistent diarrhea or blood in the stool, abdominal pain, fatigue, and weight loss. Symptoms can vary widely depending on which part of the GI tract is inflamed. My daughter also experienced symptoms such as mouth sores and inflammation of the skin. Many people also experience flare-ups, alternating with periods of remission. Patients with moderate to severe Crohn's disease experience fatigue, which impairs their quality of life. What was it like when you first got diagnosed?
I didn't really know anything about Crohn's, so it was like, what is that?
Mm-hmm. And I know we were going back and forth with the doctors whether it was colitis or Crohn's. They had reviewed the biopsies
And
and
they saw a granuloma or something.
granuloma. Yeah,
And that points to Crohn's, not colitis.
exactly. So at that point, we knew it was definitively Crohn's. Crohn's disease is a chronic inflammatory bowel disease that causes inflammation anywhere along the GI tract, most commonly in the small intestine and colon. Unlike ulcerative colitis, another type of IBD that affects only the inner lining of the colon, Crohn's can affect all layers of the intestinal wall, from the mucosa to the serosa. It is deep inflammation. One key feature doctors look for when diagnosing Crohn's is a structure called a granuloma. Granulomas are clusters of immune cells, mainly macrophages, that form in response to chronic inflammation. They're like little scars left behind by the immune system's prolonged activity. Granulomas are important because they're considered a hallmark sign of Crohn's disease. While not always present, when granulomas are found in a biopsy, they help confirm and diagnose Crohn's and not ulcerative colitis. This is because granulomas do not occur in ulcerative colitis, making their presence highly specific to Crohn's. Diagnosis of Crohn's disease involves a combination of lab tests, imaging studies, and endoscopic evaluations. Blood tests are the first step in diagnosing Crohn's. They check for inflammation, anemia, and infection. They help rule out other potential causes of the symptoms. Endoscopies are crucial for diagnosing Crohn's disease. An endoscopy is a procedure in which a thin, flexible tube with a camera is inserted through the mouth to view the esophagus, stomach, and the duodenum, which is the first part of the small intestine. A colonoscopy is a procedure in which a flexible, camera-tipped tube is inserted through the rectum to examine the entire colon and the ileum, which is the end of the small intestines. Both procedures detect ulcers, inflammation, or strictures. Biopsies, which are small tissue samples, they can be taken for microscopic examination, helping to get to a diagnosis of Crohn's. An MRE can also be used in diagnosing Crohn's. MRE, magnetic resonance enterography, is a specialized type of MRI that's used to get detailed images of the small intestine. It provides a clear view of the small intestine without radiation, helping doctors identify inflammation and complications associated with Crohn's disease, especially in areas not reachable by colonoscopy. A colonoscopy or endoscopy allows direct visualization of the intestinal lining.
How has your life been since leaving the hospital? What has changed for you?
So every morning I have to take some pills and oral liquids for the steroids and then the side effects of the steroids. And that kind of tastes gross. But also at night I take some iron supplement pills.
Vitamins for the deficiencies that you have, and basically steroids, and also some infusions, right?
Yeah, so it'll start for like 2 weeks. I'll go to the hospital again and get an infusion. They'll put it into the arm. And then for like a couple of weeks, I'll do every 2 weeks. And then it'll be 4 weeks. And then, so once a month and then once a year. And then by that time, there's an option where I can just do it myself. Or I can go to the hospital and they'll give me an infusion.
Yeah. And when you say by yourself, you mean at-home injections?
Yes.
While some people are able to manage their symptoms with at-home injections, others may need a more intensive treatment like Remicade infusions. Remicade is an immunomodulator, which means it works by calming down the immune system, something that's especially helpful in moderate to severe cases. Remicade is given through infusions, and it typically requires a tapering schedule to help the body adjust over time. This approach is especially important because the exact cause of Crohn's disease is still unknown, and treatment often focuses on managing the immune response that contributes to inflammation. Even though the cause or causes of Crohn's disease is unknown, it is thought to be the result of a combination of factors such as genetics, environmental triggers, and abnormality in the immune system. Diets high in fats and processed foods and stress are not causes, but they may increase the risk in developing the disease. Both factors, diet and stress, aggravate the disease. Crohn's is thought to result from an inappropriate immune response to gut microbes in genetically susceptible individuals. Mutations in genes like NOD2 increase risk. The immune system mistakenly attacks healthy tissue, leading to chronic inflammation. This affects the digestive tract, especially the terminal ileum, and can cause scarring, narrowing, and malabsorption.
What is that like for you to have a disease that you know it's not curable? What impact does that have on you?
And if I take the medication, I'll be well.
So it's manageable, right?
Yes.
Crohn's disease is complex and requires a multifaceted treatment approach. While it can't be prevented, it can be managed through medications, diet, and sometimes surgery. Treatments focus on reducing inflammation and maintaining remission. Combining medication with personalized dietary strategies, such as those that support gut microbiota balance, can offer more effective symptom control and improve quality of life.
If you can give a message to other children, what would that message be?
Take the pills.
And know that even though it is a lifelong disease, that it's manageable.
Yeah, it's not like you lost a leg or something.
Well, thank you, Evelyn, for taking time and answering my questions.